Moving a massive herd of cattle in a densely packed, freezing cold transport trailer triggers rapid, cascading systemic distress. In veterinary homeopathy, an allopathic diagnosis like respiratory distress is an insufficient starting point for treatment. These broad labels fail to account for the specific drivers of the condition. Effective treatment requires identifying the modality, the precise point where a physiological symptom meets an environmental stressor, and its specific aggravating or ameliorating factors. To understand how this works, we are reverse engineering 3 successful clinical cases to expose the physiological logic behind the cures. These case studies are built on the principles found in the Veterinary Homeopathic Clinical Materia Medica, a text specializing in domestic species. We examine a pig with colic, an aging cow with joint degeneration, and a goat suffering heat stroke convulsions. These cases illustrate how mapping a remedy's pharmacological mechanism to the patient's environmental and physiological modalities determines the outcome of the treatment. Consider 2 animals presenting with identical localized symptoms, severe abdominal colic and acute bloating. The first case is a pig exhibiting colicky pain, bloating, and nausea. The critical modality trigger here is dietary. The distress began immediately following a sudden change in feed. This specific presentation was treated with atropinum at a 200 C potency. Because the pig's distress is primarily spasmodic, the remedy choice is driven by atropinum's pharmacological profile as a direct antispasmodic. Resolving these severe muscle cramps stabilizes the digestive tract, directly addressing the stress caused by the diet shift. Now look at a second case, a dairy cow presenting with the same primary symptoms, distension and colic. The modality trigger here is the ingestion of contaminated or spoiled feed. In this scenario, an antispasmodic would fail. Stopping the muscle contractions would not address the root problem, the toxic load still sitting in the system. The correct clinical selection for this presentation is Apomorphinum hydrochloricum. This remedy utilizes an expulsive mechanism, inducing physiological vomiting to clear the stomach. By physically removing the spoiled feed, the remedy treats the root cause of the distress rather than just the localized pain. In gastrointestinal crises, the environmental trigger, whether a diet shift or a toxin, dictates which systemic intervention is required. This same logic applies to chronic conditions, like musculoskeletal decline in aging herds. Our third case involves a 9-year-old Holstein cow suffering from chronic back pain and a severe inability to rise. Clinical observations revealed thickened udderskin and stiffness that worsened specifically after milking. The condition was aggravated by cold, wet environments and periods of inactivity. The specific remedy selected for this profile was Formica rufa 200C. Formica rufa is used here for its specific action in resolving fibrotic joints and stiffness in older animals exposed to cold. By targeting this localized tissue stiffness, the remedy restores mobility and helps the animal overcome post-milking pain. Contrast this with an aging camel or pig showing general weakness but lacking joint fibrosis. In this different profile, the animal exhibits cold extremities and signs of cardiac weakness. Formica rufa is ineffective here because the weakness stems from systemic circulatory failure, not a mechanical joint issue. This requires the Aurum group of remedies, such as Aurum metallicum or Aurum phosphoricum. These remedies act on the cardiovascular system to restore peripheral blood flow and overall vitality. Restoring circulation directly addresses the cold extremities and the resulting physical weakness. Chronic weakness must be diagnosed by determining if the failure is structurally localized in the joints or systemically driven by the heart. The most critical interventions involved acute crises where the central nervous system is actively failing. Our final case involves a goat that suddenly collapsed, exhibiting heavily labored breathing alongside severe, uncontrollable muscular tremors. The collapse occurred during peak summer heat, indicating acute heat stroke. The animal was experiencing tetanic spasms and respiratory suppression, driven by a high febrile state. The clinical intervention was hydrocyanicum acidum at a 30 C potency. Because of the speed of the collapse, the remedy was administered at 15-minute intervals to match the velocity of the physiological decline. This rapid dosing interrupts the neurological cascade, stopping the spasms before the condition becomes fatal. Hydrocyanicum acidicum is chosen for its specific pharmacological match to seizure disorders caused by toxic or febrile states. In neurological crises, the remedy and the dosing frequency must match the speed and state of the collapse. We have examined conditions ranging from localized muscle spasms to systemic circulatory failure and acute neurological collapse. These cases demonstrate that efficacy in livestock homeopathy relies on specific objective matching. This creates a matrix where anatomical systems like the GI tract or the nervous system are cross-referenced with specific patient modalities. Success depends on connecting these systems to their external triggers, whether those triggers are environmental toxins, cold exposure, or heat. Treating surface symptoms without identifying these triggers leads to diagnostic failure. Deconstructing these cures reveals the logic of the materia medica. Every remedy is a response to a specific physiological reality. Clinical resolution is achieved when the pharmacological profile of the remedy aligns with the physiological and environmental state of the animal.